Hello, I would like to show you a short presentation of a surgical procedure of a 40 years old lady that was referred to me for implantation in the maxillary area. She has a few surgeries done prior to this referral, and this preoperative panoramic view represents the situation at time of referral. Most of teeth on the maxillary area are missing, and a few residual teeth on the left side were decided by her prosthodontic to be preserved. She also has a very severe atrophy in the area of the missing teeth, and few operations were done by other doctors unsuccessfully, and now she desired for a fixed prosthesis. So for her we designed one operation under general anesthesia, which will include the following combination of treatment, surgical treatment. This will be done via pre-preparation of computer engineering, computer aid. So the first operation would be a right maxillary sinus elevation procedure, and for the anterior atrophy, a premaxilla horizontal autologous block augmentation will be performed, and then implantation will be performed together with immediate provisionalization. So this is the case that I will present. So this is the CT scan which we used the DICOM to prepare together with the template, a pre-prepared template, to design the desired temporization bridge, the temporary bridge, and then to design the places where we want to put the implants in. And here you can see the desired position of the future implantation. All the implants are placed on the premaxillary on the right area, together with sinus procedure and augmentation, horizontal augmentation via block graft and implant placement, and then the temporization as well. So here the operation starts, a mucoperiosteal flap from the left upper canine, and this is a regular procedure with a lateral window procedure for sinus augmentation. Usually I take the window out, and later on I will put it and close the window with this bone. And then we use the pre-prepared template that was done via the computer's program only for the pilot, and then I go on and do the implantation, the tapered biohorizon implants. So we put implants in the pre-prepared position as we prepared it via the template, via the computerized, through a reverse engineering procedure, and then I use the bone substitute together with PRP, platelet-rich plasma, for augmentation, sinus augmentation, and also horizontal augmentation. 2 blocks are prepared at the lateral border of the mandibular left ramus for horizontal augmentation of the premaxilla, both to support the implants and to support the lip to get a better position of the upper lip. So I use both the bone substitute mixed with platelets-rich plasma, and then I harvest the second block and I use it for the right maxilla, and then fixed it with few 1.5 self-tap screw, and then I use the window to close the lateral opening. So for the posterior 3 implants we use 3 multi-unit, and for the anterior implants 3 temporary biohorizon units, and then I add more bone substitute mixed with PRP to close all gaps between the blocks and cover with patient-on plasma Please pay attention, this is not a membrane, this is patient on plasma, pre-prepared together with the PRP. This is was prepared together with the PRP, with the bovine, with the human thrombine. It's like a biological membrane, patients on plasma, and then suturing with layer suturing with 5-0 suture, and then mattress, vertical mattress suture. This is a second layer of suturing, and then a third layer, continuous mattress suture, and then the pre-prepared bridge is situated at the same time, and this is the result. One can see here in the postoperative panoramic view the few fixing screws at the anterior maxillary area in between the 3 millimeter diameter implants, tapered implants, BioHorizon implants, and on the right side the sinus lift procedure and the implants placed there, 4 implants placed there together with the temporary multi-unit abutment supporting the temporary bridge. On the left side we decided to leave the 3 the teeth there, and new root canal were done, and this is also with temporary bridge till the time of permanent rehabilitation. This is 2 months later, and one can appreciate the healthy soft tissue and almost no resorption. And now we'll wait for the maturation, and then we decide whether we need more augmentation via soft tissue procedure prior to the final prosthetic. Thank you very much.